If you're a loved one of someone struggling with addiction, you might feel like there's no end in sight to the problem. The reality is that addiction takes. It takes from you, it takes from your loved ones, and it takes from the person who's struggling with addiction. At the end of the day, those feeling the burden and the impact of the addicted person can oftentimes struggle with it more than the addicted person themselves. This is why it's key for friends and family to know their role in the process of opioid use disorder. You play a critical role in identifying early signs and symptoms of addiction in a person who might be facing that disorder. Early signs and symptoms might be things as simple as missing some family outings here and there, or being a bit more sedate, observing a person trying to access opioids more frequently than you think they need them from different entities. These can be things that you can address early on by talking with your loved one, asking questions, and being honest. As things evolve in the life cycle of addiction and acute moves to chronic phases, things change dramatically in the household. Many households start to observe changes in family rituals, changes in the ability of that loved one to be there and hold responsibilities that they typically provided, such as being a provider, helping with activities, children, child rearing, all those types of normal everyday responsibilities. You might have to feel the burden as the person starts going down this cascade of uncontrolled addiction and compensating for all of these problems. This can be one of the most challenging aspects of living the life with someone who's addicted, and it might feel overwhelming, but know that there is hope. One of the first and earliest things you can do is speak with the patient's provider. Feel free to talk with that person who's receiving opioids from the prescriber if they're being legitimately provided about your concerns. What are you observing at home? What are things that are changing? How are family dynamics impacted? Once you've talked to the provider, begin to plan how you're going to approach the individual who's using opioids. And make sure that you're not part of the problem. Enabling can be easy to do. It might involve you doing simple things that help that person access opioids, such as taking them to provider to access them, or compensating for all of the activities that they're no longer able to functionally do. It is key that you as a family be willing to acknowledge the things that you're seeing openly with that person you feel is addicted. If you feel that the person who is struggling with addiction is compromising the safety of your household, it needs to be addressed. You and your family have the right to stay safe, so take any steps necessary to do so. It's important that you and your family also prepare for what's called an intervention. An intervention is when you, your family, and other individuals that are important to the person struggling with addiction come together to help formulate a plan on how you're going to address it. People that might be helpful in that intervention include social workers, pastoral care, or even your prescriber. Our book offers a nice outline on how an intervention could be organized, and we encourage you to review those opportunities. An intervention might be your best opportunity to approach a person about addiction and ultimately get them to the treatment that they need. Have a plan in place. Do your pre-work or your homework, and that includes identifying what treatment programs are covered by your insurance, which ones meet standard of care through a biopsychosocial spiritual approach, and which ones ultimately meet the lifestyle needs of your family. Have these in place before you have the intervention and be willing to speak to them at the time of it. When your family member is aware of the heartfelt experiences you and your loved ones portray to them about how you've been personally affected and understands that you have a plan in place that's reasonable and able to help them, oftentimes they're very willing to make that commitment. Ask for that commitment during that intervention. I know it can be difficult. Make sure that you take the time you need and get the counseling services if necessary to help you feel whole. Addiction is a journey, not a destination, but when you travel it together with your loved one, you offer them the best chance of recovery there is. What if we are the generation that ends this opioid epidemic for good? Opioid-related overdose deaths are now the #1 cause of death in adults under age 45. Their influence has been so great, they're even reducing the American life expectancy. These trends have us fearing the worst, and as a result, we begin to view opioids as the enemy. The drugs that we've long trusted to help kill pain are now killing us, and with this, we fear what they'll take from us when we take them. But what if opioids aren't the enemy? What if our misunderstandings of them was? What if we truly took the time to understand pain and addiction from the perspective of those dealing with it? Would our stories have happier endings? You see, the opioid epidemic is always personal. I lost my own nephew, just 24 years old, after sustaining a head injury in a skiing accident, unable to live with the pain anymore and unable to navigate the medical system, to suicide. You see, the opioid epidemic is a story about all of us. It's about the people we love, the people we've lost, and the people we fear losing. Medical providers can't prescribe us out of the opioid crisis. Government agencies can't regulate us out of it. Drug treatment programs can't counsel us out of it. It is time that we start to fight the myths about opioids instead of the drugs themselves. What would the world look like if we were equipped with the information on how to use opioids wisely, store them safely, avoid their risks, and reverse their problems? It's time we turn our attention away from the battle against opioids and instead put our focus on the people who may truly benefit from their use, or those who are facing their consequences. What if we all work together? Hope is in sight, and this crisis is ours to end. This can be the generation to do it. That ending must include you.